The coronary circulation is the circulation of blood in the arteries and veins that supply the heart muscle or the myocardium. The coronary arteries supply oxygenated blood, and the cardiac veins drain away deoxygenated blood from the heart. Since the heart functions continuously, its circulation is of major importance, not only to its own tissues, but to the entire body. The coronary arteries have maximal blood flow during diastole and minimal blood flow during systole because of compression of the arterial branches in the myocardium during systole. Let's take a look at where the coronary arteries originate from in the ascending aorta. Two coronary arteries originate from the ascending aorta, that is the left coronary artery and the right coronary artery. There are three aortic sinuses in the wall of the aorta, just superior to the aortic semilunar valve, namely the right aortic sinus, the posterior aortic sinus, and the left aortic sinus, which are highlighted in yellow in the diagram. The left aortic sinus gives rise to the left coronary artery, and the right aortic sinus gives rise to the right coronary artery. The right aortic sinus is also known as the anterior aortic sinus. We'll be discussing each coronary artery and its branches separately. Let's start with the right coronary artery. It arises from the anterior aortic sinus and runs between the root of the pulmonary trunk and the right auricle. Then it descends in the right coronary sulcus. The sinoatrial nodal artery is a branch of the right coronary artery which supplies the SA node and the right atrium. The right marginal artery supplies the inferior margin of the right ventricle. The posterior interventricular or the posterior descending artery supplies the posterior 1/3 of the IV septum, the inferior surface of the right ventricle, and a portion of the inferior surface of the left ventricle. The AV nodal artery supplies the AV node. The left coronary artery arises from the left aortic sinus, passes between the pulmonary trunk and the left atrial appendage, and then divides under the appendage into two branches. The left anterior descending branch, also known as the anterior interventricular artery, is the chief source of blood to the IV septum and the apex. The left circumflex artery supplies the left atrium and the posterior left ventricle. Let's take a look at how deoxygenated blood is drained away from the heart. The coronary sinus is the largest vein draining the heart, and it lies in the coronary sulcus. It opens into the right atrium and has a one-cusp valve. It receives the great cardiac vein, the middle cardiac vein, the small cardiac vein, the oblique vein of the left atrium, and the posterior vein of the left ventricle. The great cardiac vein begins at the apex, turns to the left to lie in the coronary sulcus, and continues as the coronary sinus. The middle cardiac vein begins at the apex, ascends in the posterior interventricular groove, and drains into the right end of the coronary sinus. The oblique vein of the left atrium empties in the coronary sinus at the left end. The small cardiac vein runs along the marginal artery and then into the coronary sulcus. The anterior cardiac veins drain the anterior right ventricle, cross the coronary groove, and end in the right atrium directly. Coronary artery dominance is determined by which coronary artery gives rise to the posterior interventricular artery. If the right coronary artery gives rise to the posterior interventricular artery, the coronary circulation is classified as right dominant. If the left circumflex artery, which is a branch of the left coronary artery, gives rise to the posterior interventricular branch, then the coronary circulation is classified as left dominant. If both the right coronary and the left circumflex arteries give rise to the posterior interventricular artery, the coronary circulation is classified as codominant. Approximately 70% of the general population are right dominant, 10% are left dominant, and 20% are codominant. The coronary arteries are clinically significant since they are the only source of blood supply to the myocardium, and a blockage of these vessels can be quite critical. Coronary atherosclerosis is characterized by deposition of plaques containing cholesterol, lipids, or fibrin clot onto the internal surface of the blood vessels. Plaques impair myocardial blood flow by narrowing the vessel lumen, leading to ischemia and infarction. Coronary angioplasty is an angiographic reconstruction of a blood vessel by enlarging a narrow coronary arterial lumen. It is performed by peripheral introduction of a balloon-tip catheter and dilation of the lumen. A metal stent is often placed if the lumen doesn't remain open after initial angioplasty. Here's a little question for you guys to test yourself and see how well you understood the concepts. A 55-year-old patient recently suffered a myocardial infarction of the apex of the heart. The occlusion by atherosclerosis is in which of the following arteries? The marginal artery, the right coronary artery, the anterior interventricular artery, or the posterior interventricular artery. You can pause the video for a few seconds to choose your answer. The correct answer is the anterior interventricular artery. Notice that the statement mentions an infarction of the apex of the heart. Therefore, in order to select the correct answer, we need to identify which of the given arteries supplies blood to the apex of the heart. The apex receives blood from the anterior interventricular branch of the left coronary artery, so option C is correct.